Take charge of the facts. Everything you need to know about teens and epilepsy.
Diagnosis is probably the most important thing, because your selection of drugs, selection of treatment, and developing a feel for what the future holds all depend on the correct diagnosis.
I think imaging of the brain, to include MRI, is necessary in almost every case. That an EEG is exceedingly helpful. And that certain blood tests, depending upon the historical information that you've obtained, may be very important.
Most epilepsy is easy to treat. 70% of epilepsy can be treated and controlled with one medication.
I have absence seizures. I've had it since I was 3, but I haven't had a seizure since I was probably 10. I'm 16 now, and they're controlled by medication.
So medication works?
Yeah.
When I give patients medication, I advise them that this is one of many choices that we have, and that we try preferably one drug at a time.
Certain medications, they aggravated my seizure. Some knocked down my white blood cell count, and they had to change it, but the majority of them aggravated my seizures. Then finally they put me on this one medication that finally controlled my seizures throughout. It probably took a good several months before they finally found the right one.
It's a relatively well-established fact that if a patient is not controlled on 3 medications, there's less than 5% chance that that person eventually will be controlled by another medication. Doesn't mean it doesn't occur, but it's so small, the percentage-wise, that at that point you try to determine are other interventions beneficial.
I think it's important to realize that most people that are diagnosed with epilepsy will be completely controlled by medications. Most people with epilepsy have normal range of intelligence, don't have any limitations on their life, and can ultimately live an unrestricted full life.
Now you've got the facts, so spread the word and do your part to make sure there's not another moment lost to seizures. To learn even more, go to takechargeteens.com or epilepsyfoundation.org or call 888-886-EPILEPSY.